thank you, Leslie, very much. And I will have a few toothbrushes at Halloween. I haven't actually done that, but I will. I can do better. I can follow her lead. And now we move to the other side of the country, to the Big Sky State, to the state of Montana, where we have an opportunity to hear about a different set of challenges and opportunities, work being done in not just more rural places, but also less dense places. Cathy Costakis comes to us to talk about the work that she's done across Montana with nutrition and physical activity programs there, as well as a recent visit I hope she'll bring in to Copenhagen, where she was, I think, lucky enough and privileged enough to go to think about what she's doing in Montana in the international context. And when you're done, you'll want to make her the mountain of Montana. Cathy Costakis.
Thank you, Bill. And I knew it was going to be a problem to follow Leslie on this stage because it was an incredible presentation, both of you, actually. So I am thrilled to be here to talk about the work that we're doing in Montana. As you can see, Montana is a large rural state. This is my drive to many of the communities that I work in. And our population density at a state level is about 6 people per square mile. So I'll be talking about building rural capacity, building multi-sector partnerships, why we're focused on policy and planning, and give you 2 case studies and then follow up with a few thoughts that I have. So as we know from the research, rural communities experience higher levels of chronic disease, and we think that is related to obesity. And in recent research, they've been trying to tease out what can explain those differences. And along with the educational attainment, there are also economic and built environment at the neighborhood level that can explain those things. So we know that we're on the right track working in built environments. Montana, although people think of us as this healthy state, and we are, we still have the same rates of obesity rising since the 1980s. And even though you think of us as out there being very active, 3/4 of our adults are not meeting physical activity standards, and about that many of our youth not meeting physical activity recommendations. So we began this work in about 2005 when we got our first capacity building grant from the CDC. And I'm not going to go through all of these different grant cycles. The point of this slide really is to talk about the fact that this is long-term work. This takes time. Doesn't fit neatly within a grant cycle from 3 to 5 years and you have these great outcomes. This is very long-term work. First, you need to build relationships. Then you need to understand the policy implications, work with multi-sectors, as we've been hearing. It takes time. And frankly, we're very grateful to the CDC for the opportunities that they've given us to do this work, because without that funding, we could have never done this. So, I was going to say that we started working with a couple of, these green areas are the areas that we first started working on this built environment work with local health departments. We gave them about $15,000 and we told them to work on built environment. And they looked at us with their eyes crossed going, "What is that?" And we said, "Oh, you should meet with your city planners and you should go talk to your city engineers and really talk about how you're going to change the built environment." And they're like, "But we have H1N1 and we have the WIC program and we have immunizations. We have all this stuff we need to do. And you're giving us $15,000 a year to do what?" And so it was difficult work and it was hard. But I'm going to talk about a couple of different counties, one of which is Lewis and Clark County, which is where our state capital is. And then after, I'm going to talk a little bit about Park County down here, which is right at the entrance to Yellowstone National Park. But to better understand our policy landscape, we did a survey back in 2010 to find out what kind of policies were in place. What were we talking about? And we surveyed all communities of 1,000 people or more. And we asked them a whole bunch of questions about sidewalk policies, about bike policies, about whether they had master plans or what. And one of those was a gold standard sidewalk policy, 5-foot sidewalk with a boulevard planting strip between you and the street. And we found that 38% of those communities had that kind of policy in place. And so we thought, wow, that's not that great. But when we teased it out, we found that some of the larger communities had those policies, and most of the smaller communities did not, and most communities did not have policies around sidewalks or bicycles. So you can see this lack of policy reflected in the built environment. There are people out there trying to walk and bicycle, but they were not included in the facility design of the community. And that's a policy issue. We have some places where you have this great crosswalk, but as you can see, it's going to no sidewalk and no curb cut. So what if you have a disability? Is that a connected network for you? And again, on the photo on the right. And then in many rural communities, the only place to walk is the rural road. And in many cases, there is no shoulder. You're walking right in the road. And in Montana, a lot of those roads have 70-mile-an-hour speed limits. So do you really want your kids walking there? And so, and in a lot of cases, we have kids that are being driven to school just like every other place. Some of that has to do with the built environment, but also the land use component. Where are we putting schools? A lot of Montana schools, some of them are being closed and consolidated. Sometimes they have to drive to another community to go to school. So pretty hard to walk and bike there. And so we can see sidewalks to nowhere. We can see signs being put in unexplainable places. And then when you get out of the bus in a city, you might have a really nice pathway to go on, but if you're in the county, well, best of luck to you. And that's just not right. And so we have downtowns that are really trying to change this equation. So we have streetscape projects that are being done where they're adding the trees, they're adding the bike parking, they're adding the benches. And this is a community that has done that. And you can see, I just walked a few blocks. This is that tree-lined area that you see here. I walked a few blocks away, and this is the environment that you can see people are walking in. And if it was 90 degrees, where would you rather walk? So the details really matter. And then we really have to think about equity, and I know we're going to be talking about equity in our next session. But if, this is a small community, and there is a low-income part of this community as well. And so this low-income part doesn't have sidewalks, doesn't have trails, and this kid has to deal with the fact that there's flooding in this environment too. And so we need to do a better job. In other parts of this community, there are sidewalks, there are trails. So the first case study I want to talk about is Lewis and Clark Public Health. We gave them $15,000 back in 2008, and we told them, yay, go do built environment work. And of course, we had that conversation. What is built environment work? And so we provided some TA and technical assistance and some training. And then they really ran with it. They really bought into this fact that this really was a public health issue. And they started engaging the community. They started having conversations with their planners and their public works directors. And they started sitting on the Non-Motorized Transportation Advisory Committee, which they never even knew existed before. They started working with partners to do commuter challenges to get people biking and walking to work. They worked on safe routes to school issues so we can get more kids walking to school. And they also worked on this idea of selling the local government on the benefits of complete streets. And Leslie talked about complete streets. It's a really great overlay of how do we think about every street that we build? Is it working for all users? So they were able to pass a policy in 2010, much of which was the involvement of the local public health folks. And then in 2012, we were able to give them a little more money so that they were able to hire a person. This was just sort of extra work with this $15,000. Now they had a little bit more money, they could hire a person. They started having weekly meetings with their public works or their city engineer, talking about different projects in the community and how they could be made better. The engineering standards were changed, subdivision standards were changed. And actually the public health department was the one that gave money for a sidewalk assessment for the entire community. And so what were the gaps? What did the sidewalks look like? Were they accessible? And so, so then when they did their next long-range transportation plan, they actually hired a sub-consultant just to work on walking and biking issues, and it was infused throughout the entire plan, as opposed to being this siloed little section that nobody actually ever read. And then the opportunity came for this community to apply for a plan for health grant, similar to what we've heard about before. This was a great opportunity for the American Planning Association and the CDC to come together and really show that multi-sector partnership through a funding mechanism. And so they were really positioned, because of all the work that they had done up to this point, to apply for that grant. And one of the things that came out of their transportation plan was that they were supposed to put a wayfinding system into place. So wayfinding is like, where are the things? You know, you might be doing all these things great, but where are the trails? Where are the parks? Where are the community gardens? And so they have a twist on wayfinding that I don't think many communities have done, and it's called an active living wayfinding system, but it also includes access to healthy foods. So it's not only where's the library, where's, you know, other destinations, but where are the trails, and how do we get there, and what can we expect when we get there? What's the map? How do we know we're still on the trail? And so they came up with a family of signs that are really going to give this community a wayfinding method to point people in the direction of where they want to go. And at the same time, we were lucky enough to get another grant, this one from the National Association of Chronic Disease Directors and CDC, on including people with disabilities in healthy communities work. So this was we were able to layer on this idea that it really matters that you include people, all people, in your conversation around these kinds of processes that you're doing, but particularly with people with disabilities. And so we were able to have focus groups and really engage the disability community at a very intense level. So low vision, cognitive impairment, physical disabilities, to have them better understand, you know, where do they go? Where do they need to go? And what are those destinations that are important to them? Plus, what does this signage look like? It was important to them to have certain colors and certain contrasts in the signs so that they could identify that particular signage easily, even if they had low vision. So that was a very important part of this process and really helped us a lot to be much more inclusive in our process. The other thing we're working on now, we had a training. Leslie and we had talked about walk audits and the importance of walk audits. We really believe that we need to have a multi-sector team to lead these walk audits. We would always do walk audits and, of course, invite people with disabilities to come along or have a wheelchair there that someone could get in. But now we want people with disabilities to be leaders in this. We want them to be facilitators in this. We want them to be trained to know how to lead these walk audits all over the state. So that's what we're doing now. We're including people and having those conversations to have a health person, an engineer, a planning person, and a person with a disability. So walking and biking is, we think of it in big cities, but really small towns are really ideally sized to do this work. I mean, some of them are only 2 miles across. So it's a very walkable and bikeable distance. So if we can just get the infrastructure right, we'll have it knocked. So we knew that we had to work in smaller communities, and we knew that smaller communities really didn't have the capacity to do this work. The health departments are stretched. They don't even have planners. Sometimes they contract out planners, and so how do they do this work? And we really saw the need to build capacity. So our goal was to encourage policy environmental change to make communities safer, more inviting, and more accessible for walking, biking, and taking transit if it was available. So we started what we call the Bakke Action Institute, Building Active Communities Initiative Action Institute. And communities had to apply to come, and they had to make sure they had a team, a leadership team of at least 5 people from multiple sectors. So that meant elected officials, public works people, downtown business people, health people, or health care. We've had CEOs of hospitals come to this, superintendent of schools. We tell them the kinds of sectors that we think are important, but we don't dictate to them who they bring, because we know they know best who the right people are. So they convene this multi-sector team. They attend the Action Institute, which spans over about a three-day period of time. They develop an action plan at that Action Institute, and then we follow up with them and do periodic evaluations. And what we agree to do is to pay all their expenses to do this, because we know that small communities just can't, they don't have the capacity to do this. Take 5 people, five leaders out of a community for 3 days. It's in a small community. That's just tough. So we want to make it as easy as possible. So we pay all their travel expenses. We are strategic that we only pay for 1 car, so that it's a team building experience to drive 5 hours across the state. In some cases, 7 hours across the state to come to this training and then back again. So we ask them to commute together. We bring in national speakers, and we do skill building like walk audits. We've done tactical urbanism projects, which I'll talk about, and we give them training materials, and we give them follow-up technical assistance, and we connect them to resources in order to have them fulfill their action plans. But we realized that we were asking them to come in a multi-sectored way, but we weren't necessarily doing that at the state level. So we had another opportunity through the National Association of Chronic Disease Directors and CDC to go to a national walkability action institute, kind of the same thing we were doing at the state level, but at a national level. And we were able to bring our state partners, the Department of Transportation, the Department of Commerce, the Department of Health, and our statewide bike walk advocacy organization. So we brought all those people together, and now we're meeting on a regular basis. They're becoming sort of a steering committee for this Baki Action Institute. They look at the criteria that we're asking people to apply when they apply. They come to the Action Institutes, and sometimes they help fund the Action Institutes. So it's truly a collaborative effort, and we call ourselves the Montana Walkability Collaborative. So, so I would say that this has been really important, because we bring the resources right to them. So they're like, well, we'd like to do an active transportation plan, and then the Department of Commerce says, well, we'll help you with that, we'll fund that. And so that's how this has been going lately. And it's an amazing thing. We have maybe 50 participants at our Action Institute, and we have maybe 30 people that are there just to help them, which is really fantastic. So we work across Montana. These are all the communities that we've worked in. And just a little side note, if you take a drive from this part of the state to that part of the state, it's like driving from Chicago to Washington, D.C. So that gives you an idea of the spans of geography that we're working with. So here's some of our outcomes. We worked initially with some of the larger communities to pass complete streets policies, but then when we started the Baki Action Institutes, these teams have now been not only working on complete streets policies, but they're working on growth policies, they're working on downtown plans, they're working on transportation plans. So all of the guiding documents of a community, this team of people are getting involved with and making those changes, making them more walkable and bikeable. Okay, so one of our small communities that we're working in is Park County. Park County is about the size of Delaware, and it sits right above Yellowstone National Park. They came to the Baki Institute in 2015. Their audacious goal was to map the entire county for active transportation, and they had a whiz-bang GIS guy that did that. And so they did a lot of outreach to the small communities, and they have a plan now for how they're going to make this county a connected place for walking and biking. They have an active transportation coalition in place so that they can work on the implementation of that plan. Then they said they're the largest city. We need to get the largest city in the county involved. So they took a city-county team to the 2017 Action Institute. And now they're working on a big community outreach campaign and messaging campaign, because they know, this message does not necessarily play as well in small, rural, conservative communities. So they know that doing that kind of outreach and education is really important. And the city is actually working on an active transportation plan. One of the things that is difficult, because these small communities really, they're a little bit policy averse. They don't really like policy, but we encourage it. But one of the things that helps is doing these pop-up demonstration projects. So having people understand what is possible by doing these temporary low-cost things. So at the Livingston Farmers Market, they actually had, they found that it was an unsafe farmers market for kids and people walking and biking. There's all these cars driving around. So they really, they worked on, they put a roundabout together with hay bales. They did some pop-up protected bike lanes and sidewalks, crossings. They had a valet parking for bicycles. They just tried to make it a lot easier for people walking and biking, and this has led to some permanent change at their farmers market now. They closed the streets. They have a much better and safer environment for people walking and biking at the farmers market. And we've been doing these pop-up demonstration projects around the state. So you can get on the internet and type in what you want and have pop-up wayfinding systems. It's called Walk Your City. And we have done pop-up parklets where people are now sitting and talking, and the Community Foundation is now funding this on a more permanent basis. This was doing a temporary crosswalk. So these temporary low-cost ways are a way to test out things and a way to get the community engaged and understanding what you're trying to do so that you can have bigger capital expense projects later down the road. I don't have time to talk about this, unfortunately, but this is an incredibly cool food resource center. I would encourage you to look this up, Livingston Food Resource Center. But one of the things that I want to say is when they talked about building a new building for this, they looked at a 5-minute walk radius around where the old food pantry was and where they decided to put this new one. Where the old one was, there were 14 people that could walk or bike within a 5-minute walk. The new one, 124 people. So where we place things is incredibly important. So my major takeaways are this is multi-sector and multi-level work. We need to be doing this at the state level and the local level. Especially in rural communities, we really need to build the capacity of these places to do this work because it's not easy work. And all change is local. So we know the communities know best. We're not top-down telling them what to do. We're just giving them some good information and having them understand what the best way to go in their community is. Trying things, lighter, quicker, cheaper, whatever you want to call it, tactical urbanism, is a really great inroad to getting people excited about the possibilities. And we share successes across the state, because many times people don't know from across the state what people are doing. And so we have a little newsletter. And basically we need to break down silos. This is kind of a rural example of how we need to work across silos. And we have limited dollars, so if we're not working all in the same direction, it's just not going to work. And I say the best tool that I've come up with is taking a walk and having the eyes of a child, the eyes of an older adult, the eyes of a person with a disability. And it's a very powerful thing. So thank you very much.